Welcome to the Perinatal Wellbeing Podcast. I'm Christine, your host and certified perinatal mental health professional. This podcast is all about authentic conversations. We want to open up the discussions around perinatal health and well-being, from mood and anxiety disorders to breastfeeding to grief and loss in the perinatal period, and everything in between. While this is not therapy or medical advice, it is the place where we are going to continue to open up the discussion around all things perinatal mental, physical, emotional, and sexual health to help reduce stigma and break down these barriers to support. I acknowledge that many Indigenous nations have long-standing relationships, both historic and modern, with the territories upon which Perinatal Wellbeing Ontario is located. Today, this area is home to many Indigenous peoples from across Turtle Island. I am proud to acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. I acknowledge that I am a settler on these lands, and it is on these ancestral and treaty lands that I live, learn, and work. Hello, and welcome to Perinatal Wellbeing episode number 11. My guest today is Nicole Leijh, registered social service worker who is a perinatal therapist in private practice in Muskoka, Ontario. Over the past few months, we've gotten to know each other and become friends, and I was so honored when Nicole agreed to share her experience with an ectopic pregnancy. Nicole endured a lot last year and shares her story in order to raise awareness about ectopic pregnancies and to advocate for more education and better care for people experiencing pregnancy loss. You can find Nicole at lynxlakecounseling.ca. lynxlakecounseling.ca. Please know that in today's episode, we discuss pregnancy loss, trauma, surgery, a near miss, and grief. Hi, Nicole. Thanks so much for joining me on the podcast today.
Thanks for inviting me on.
Yes, of course. So today, I want to just tell everyone who's listening that today's topic is about pregnancy loss and more specifically, ectopic pregnancies. And so if this is something you have experienced or it's something that may weigh heavy on you, feel free to pause here, come back to the episode at a different time, and listen to it when you can. And if you are listening to it, just take care of yourselves through it and afterwards. So, Nicole, can you actually just explain to us, if you could just kind of define for us, what is ectopic pregnancy? Because I just don't think we talk about it enough.
I 100% agree.
Yeah.
It's not.
Yeah.
So the simplest way of explaining what it is just an out of place pregnancy.
Okay.
So it's where the gestational sac, the fertilized egg, ends up anywhere else but the uterus.
Okay.
So most commonly it's in the fallopian tubes.
Right.
But it can also be in the ovaries, it can be in C-section scars, and it also has been in rare cases outside in the abdomen. That will be a pregnancy of unknown location, which can be very tricky.
Wow. I'm assuming then that's tricky for doctors to find afterwards, when they realize that it's an ectopic pregnancy, but trying to locate it.
Yes. Yeah, it would be very difficult, also very difficult to treat, because if you can't find it, then
how do you treat
you can try doing it with the medication that I can talk about, or else it'll have to be surgery. That one I'm not as well versed in.
Yes.
Mine was a very common one, found in the fallopian tube. And
Okay. So do you want to tell us about your experience with an ectopic pregnancy?
Sure can.
Yeah.
It's something that wasn't even on my mind at all.
Right.
My partner and I had experienced a miscarriage about 4 months before this. I didn't even think that I could be pregnant this time around. And honestly, if I wasn't doing the temperature check, which people who, if they're trying to have a baby, they'll probably know about the temperature check. If I did do that, I wouldn't have even known I was pregnant.
Right.
And there would have been a good chance that it would have been a lot more of a dire situation if I didn't know that I was pregnant.
Okay.
So I'm glad that I was doing that.
Mm-hmm.
So found out I was pregnant in February of 2021.
Okay.
And tried to be excited about it, but if anyone has experienced loss previous, then there's a lot of fear and there's a lot of anxiety that goes with a subsequent pregnancy. So I tried my best to stay positive, and this is a good thing. About the 7-week mark, I'd say, is when I started to notice signs of a miscarriage again. So the signs were similar, but slightly different. There was bleeding, which is common. There was also pain, which I just assumed that maybe it was all miscarriages are different. So this was just a different form. There was a night in particular that it was so painful that I couldn't attend dinner with my family. I had to go lay down because I couldn't move.
Yes.
And I thought, okay, well, I'm experiencing another miscarriage. This is just what I have to go through, I guess. I had a dating ultrasound booked at the 8-week mark, and I decided, since with my previous miscarriage, I needed to do the ultrasound anyway. So I just decided to keep it. They'll check to make sure that that is in fact what I was going through. So I kind of just made my way through that week, to the point where there was another time when it was so painful that I ended up collapsing on the floor and curled up and started to cry and told myself, this is more than just a miscarriage. And like any child would do that has a good relationship with their parents, I called my mom.
Yes. Yes.
Laying on the floor saying, Mom, come help. So she came up, and I still went to the dating ultrasound. I told them straight away that I think I'm experiencing another miscarriage. I know the signs and symptoms of it. More so because I didn't want to hear that speech that they give you of, I'm really sorry, but ... I didn't want to have that. I just wanted to say, you know what, I already know. You don't have to go through this heart-wrenching conversation. Yeah. So she did the ultrasound, and she was very chatty at first, and then her mood completely shifted. She didn't want to make eye contact with me. She was really quiet. I knew something was up. She turned to me and said, you're definitely pregnant, but it's not where it's supposed to be. It looks like it's actually in your fallopian tube. And it took me a while to figure out what was happening. Yep. And I just started crying. Yep. And she was so supportive. And I just felt so bad because it felt like she was going to cry with me, because she was just like, this is devastating news. Yes. COVID. So I was by myself.
Gosh.
I asked if I could at least call my husband just to let him know, and said that he's right outside. I just need to at least call him. I need to tell someone. And she said, you know what, how about I just let you sneak out, tell him, but then come in, because you have to go to emerge immediately. This is something that needs to be looked at right away. Okay. So that was terrifying. Yeah. I ran out. I told my husband. He has no idea what an ectopic pregnancy is. So I'm basically running out through the parking lot crying, saying, this is what's going on. And then I leave him out in the parking lot to go into emerge.
Oh my gosh. Because of COVID, at this point, you also had to go into emerge by yourself. Is that right?
Yes.
Oh gosh.
Yeah.
Okay.
But the tech that was on, she was amazing. She was lovely. She said she was going to wait by the door, which she did, and she was going to walk me right over and make sure I was checked in and everything. She didn't want to leave my side, which was amazing.
Lovely. That's so nice.
Yes. So she did. She walked me over to emerge, where I had to wait in the hallway, which I think I just looked shocked. Probably there was this sweet lady that was sitting down, and she just asked me, "Hey dear, are you going to be okay?"
Oh.
I didn't even know what to say.
Yeah.
I said, I hope so, but
yeah.
I don't know, right? So I get into emerge, and I see the doctor, and he's very calm and comforting almost. And so he tries to explain the situation to me, and I know of ectopics, but it's not something I I knew a lot of, and never thought it would be me that would go through it.
Right.
So he explained it to me, and one of the nurses came in because she was taking my blood, and she said, you know what, you really shouldn't be alone. I'm going to try and sneak your husband in.
Oh, that's
So,
lovely.
I mean, if we weren't in such a small hospital, that maybe wouldn't have panned out if we were, down south in Barrie or Toronto or something like that.
Yeah.
So my husband thankfully could come in. They explained everything to him. And the next steps were they called a surgeon down in Aurelia, and she said, you need to come down here immediately. It's looking like surgery is likely going to happen, but we could maybe talk about medication. So packed up our stuff. We drove down to Aurelia to emerge down there. We waited around for a long time, it seemed. I think it was like 8:00 at night by the time I actually got to see them.
Wow.
And she said, you know what, I'm feeling pretty confident that we could give you what's called methotrexate. So it's a chemotherapy drug in a high dose. It depletes your folate level, and it stops cells from rapidly dividing, how it works with cancer. So that's what they're thinking with the embryo, that it will stop the cells from reproducing and the pregnancy. So I said, yeah, sure. I don't want to go in surgery.
Yes.
So let's do this. Let's take this route.
Yeah.
So I was given the medication and sent home, and it was a weird feeling. It was a weird feeling because, there was still no guarantee that my fallopian tube wasn't going to rupture and cause internal bleeding.
Right. And at that point, did you know, did they explain to you the risk of that happening?
They kind of danced around it.
Okay.
I'll say.
Okay.
Yeah.
Right.
It's weird because when I left our hospital, we were told surgery is probably what's going to happen. So just kind of mentally prepare for that.
Right.
And then when I left Aurelia, I was like, okay, so maybe it's not as bad, but still a very strong possibility that it could happen.
Right.
Not given much information. Not given any information really about what an ectopic pregnancy was or anything to look over, because as someone going through a traumatic event, you just saying words to them, it's probably not going to stick.
Yes. Yeah.
Unfortunately.
Yeah.
Right. So you going through all this list of things to me, probably not going to remember everything. So it would be nice to give me some information. So, like most people, hopped on Dr. Google to try and figure out what was going on. So that was terrifying in itself.
Yeah.
So I went home. She said basically, don't go skydiving, but I should be okay.
Wow. Okay.
Yeah. Well, because I was like, well, what can I do? I still have something going on.
Yes.
I don't want to.
Right.
So is there things that I shouldn't do? And that was her response of, well, you shouldn't go skydiving. Like, okay.
Wow. Okay. That doesn't seem very helpful.
It will. Yeah. In the moment.
Yeah.
Yeah.
Right.
I think it was maybe just trying to get some comedic relief out of the situation. I don't know. But
yes.
So when I did some research on my own, from what I could tell, a lot of people aren't given the methotrexate dose when their HCG, the pregnancy hormone, is above 5,000.
Okay.
And mine was sitting at about 8,600.
Oh, wow.
And also not usually given, I think, more than 6 to 8 weeks. And it was 8 weeks and 2 days where I was given the medication. So I was already over that.
Right.
And that was a common thing that I was seeing through looking everything up. So I was thinking, why did they try and do this? And my highly anxious brain the whole time, that I was a ticking time bomb. That was my thing. I am someone who experiences a lot of anxiety, but that was a whole other level. I was basically living in a constant state of panic, to the point where every day I'd find myself just trying to breathe and my heart was racing and I couldn't focus on anything because I was, in a sense, walking around with a ticking time bomb. If that ruptured,
what would happen?
there's right.
Yeah. And how long were you kind of living in that state? How long was that?
Well, see, the thing is, if they were just going to go the methotrexate route and it was looking like it was working,
Yeah.
it can take anywhere from 4 to 6 weeks on average for your numbers to go down to 0, which is what they want to see. Right. So you can rupture all the way down until you're at, I think it says 5, but you can rupture at any time.
Wow. So that, even that thinking, I could potentially be, taking this medication and then waiting up to 6 weeks for this to really kind of resolve. That is a long time to think that you're going to have to walk around in this highly anxious, panic state.
Right.
My goodness. Wow.
Yes. And take care of a toddler at the same time.
Right. And so you didn't really give the backstory there either, but how old was your son at that point?
Well, he was 19 months.
Wow.
I know that because the surgery date was exactly 19 months. Wow. So
okay. Who was taking care of your son at that point? Like when your husband took you to the hospital, like who was there to support you and take care of your son?
My mom.
Your mom.
She came up and basically shifted her whole life and moved up to take care of us for about a month.
Wow,
so
that's lovely.
I'm very thankful for that.
Yes.
Yeah. I was going to say I'm lucky. I don't think any of this is lucky, but yeah. I only had to experience that kind of anxiety for a week because it was exactly 1 week to the day when I started experiencing some pain.
Okay.
And so they told me that if I get any kind of pain at all in my abdomen, or there's a couple other spots like your shoulder, right? If you start experiencing any of that kind of pain, then go to Emerge right away. When you go and check in, say you have an ectopic pregnancy, and they will scurry you in.
Right. Okay.
So I started getting pain, but from what I could tell from other people's experiences, they were flat out on the floor. They were screaming in agony. Like it was a very painful experience for a lot of people. And I was like, this isn't too bad. So maybe it's just, it's working. The medication's working. I was trying to talk myself down.
Okay. Was the pain less than that pain you had when you, at first, when you like fell on the ground and you knew, oh no, that something's going on. Like I think this is a miscarriage before the ultrasound. Had the pain subsided from then?
It did. It was similar pain though. So it was pain in the sense that I didn't want to move. It was like a bad period cramp.
Okay.
But like a really bad one that you just can't move.
Yeah.
And so I would just I laid in my bed actually and just waited for it to kind of calm a little bit.
Okay.
And then my husband, in the calmest tone he possibly could, saying, maybe we should call 911. And I said, I don't think so. I'm not quite there.
Right.
And instead we called a couple of our really close friends that knew the situation. So that we would have someone there with my son, someone to take me that whole shift in things. Yes. My mom didn't come up until later in the day, and then she would have kind of switched over. Yeah. So they came over, and I was kind of basically voluntold to go to the hospital. I didn't really have a choice at that point, which in hindsight obviously was the best. Was the best move.
Okay. Can I ask you, and I ask you these questions to break it down for the listeners so that in case anyone has any type of similar experiences, of course, everyone's experience is different, but to be able to understand and say, oh, this maybe feels more than, just a cramp, or, knowing maybe I do need to reach out for help. What do you think, looking back, stopped you from saying, okay, yes, it's time to go to the hospital?
The biggest part that stopped me was that everything I had read about it was that people were in like crippling pain. Like they couldn't move. They were like, they were screaming in pain. It was, and I honestly, it was painful, but I was still breathing. I was still talking.
Right.
I was still, able to, it just, it wasn't as big a pain in my mind
Right.
that a lot of people were saying,
Right.
which is silly because everyone experiences it differently.
Absolutely.
And I know that,
Yeah.
but I was so scared of going to the hospital and being away from my son, which I had not been away from since he was born.
Right.
So that was also weighing on me.
Absolutely. And so I'm guessing that if you were discharged from the ER originally with more information, or like an information pamphlet on ectopic pregnancies to take with you, you probably would have been able to maybe assimilate that information a little bit and say, okay, maybe this is still concerning because I'm having pain, even though it's not excruciating like I'm reading about on the internet.
Yes, 100%. Yes.
Okay.
Yep. And other information just about signs and symptoms of an ectopic pregnancy,
Right.
that I could have pinpointed more before that 8-week scan. I could have potentially known to go and get looked at before that,
Right.
which just blows my mind. And even nowadays, when you do find out you're pregnant and you go to your healthcare provider, and I don't know if it's like this everywhere, but up here, like Muskoka Perry Sound, a lot of times they won't book you in for your dating ultrasound till 8 to 12 weeks,
Yes.
whereas they really should be doing ultrasounds earlier than that for this very reason.
Yes.
And that is something I would love to see happen to potentially avoid this from happening, right?
Absolutely. Right. Okay. So you were voluntold to go to the hospital.
Yes.
Yeah. So what was that like? What did your husband call 911 and get you in an ambulance, or did someone drive you there?
No, my friend actually drove me in while my husband stayed with my son.
Okay.
And they were right. When I got to the hospital, I said, I have an ectopic pregnancy, and they didn't even second guess it. They just took me right over to Emerge, which was great.
Yeah.
They had me hooked up to the IV pretty much as soon as I got there. The first nurse was lovely, pretty much went downhill after she had left, to be perfectly honest. This hospital stay was not as comforting or supportive as the first one. So I was kind of going in and out of waves of pain. And at the beginning, I wasn't allowed anyone with me. Again, my husband did come in. Oh, he'd probably been a couple hours after I had been there. He was allowed to come in. I was there for, I want to say around 2 or 3 in the afternoon. So I was there for about 5 or so hours. It was a long time.
Wow.
It took me a while to get an ultrasound. I had to wait a good couple hours to get into the ultrasound. And the nurses had to try and draw my blood to see my HCG levels. And not even joking, they tried at least 8 different times. They poked me at least 8 different times to try and get my blood. It was so painful and so frustrating. I can't even put into words just how upsetting it was. I've never had issues getting blood drawn before. I had the IV already in. I know that they've taken it through that way. So I had asked towards the end, I said, you guys have to stop. This is making me so uncomfortable. This is so painful. Can we not do it from the IV? And she's like, I don't know. We're not really supposed to. You've had it going in for so long, blah, blah, blah. She left. I don't know, 15 minutes later, I don't know. Time was a blur.
Yes.
Another nurse came in and said, hey, how about we take it through your IV? It's like, all right.
Oh,
Thanks, guys.
yes.
Thanks for coming out.
Yeah.
Either way, so that was fine. I did the ultrasound. The tech seemed lovely, chatty. So I kind of had this feeling of, okay, so maybe it's not that bad. Maybe the medication's working. She seems,
Right.
okay.
Yeah.
Went back to my bed, had the doctor come talk to me, who was not the nicest doctor. Didn't have, what's a nice way of saying it? He didn't know how to empathize with me. I was crying and panicking.
Yeah.
And his response was, why are you crying? Like, why are you upset? What's going on? And it just came off to me like, do you not realize that I could be dying essentially in my head? I'm like, this is, this is terrible. And you're just sitting there being like, hey, buddy, what's going on?
What's up?
Wow. Didn't work for me.
Right.
So, waited a little bit. He gave me the results. I'll still remember when he said, well, so you still have an ectopic pregnancy. And my husband and I looked at each other like, yep. Yeah, we know it's not going to disappear in a week.
Right.
Fairly certain about that.
Yep.
He said that rupturing was imminent and that I needed to have emergency surgery right away. And that took a little bit of time for that to soak in with me. And he said, unfortunately, the surgeon I was talking to in Aurelia, they don't have space for you. So I have to go and talk to, I guess there's a line that they call that connects to all the hospitals in Ontario. And he said, I need to call them and I need to send you to whatever hospital is available tonight. So basically, you could be sent to, Ottawa, to Sudbury, to Toronto, to wherever.
Right.
We'll airlift you if you have to. And then he left.
Oh, wow.
So,
and how were you feeling?
Terrible.
Yes. How were you feeling in that moment? What were you experiencing?
I was experiencing every negative feeling you could possibly have, I think, because I was so angry with how he presented that.
Right.
So angry.
Yeah.
So frustrated. I thought, if you're going to drop a bomb like that on someone, how about get all of your information
together
and then come back and deliver it to me.
Right.
I realized maybe, I'm ignorant to how hospitals are run. I'm not there. I don't know how this whole process goes, but I feel like that little bit of information would have been good to gather before dropping that on me when I'm already in a state of absolute panic.
Right. Right.
The flip side, not the flip side, but the other side of that was I had not left my son for longer than, that previous hospital visit. So longer than, we'll say 10 hours or so.
Yeah.
Since he was born.
Right.
So in that whole 19 months, I had not left him. And now he's coming in telling me that I could potentially be shipped off to anywhere in Ontario to be away from him.
Yeah.
I feel like I was more terrified by that than dying.
Wow.
So it was a heavy, heavy moment for sure.
Yeah. And so kind of you don't even really have the chance also to worry about yourself because you're panicked and upset about leaving your son. Yes. That is such a heavy layer for sure.
And the thing is too, is that I didn't realize that I was suffering from postpartum anxiety and depression. To that severity until that moment. Okay. Or shortly after, when I realized that I was more worried about being separated from my son than I was of dying.
Right.
And that took a lot of processing after the fact too of, okay, wow, like I really could hide my mood disorders under the pandemic. Right. Like I was able to hide a lot of that the experiences I was going through because of that. I was sheltered, but then in that moment, I was like, wow, okay, I need to really think about how to take care of myself. Yes. But it took a little bit of time to actually paint that picture for me after the fact.
Absolutely.
Just interesting thing looking back.
Absolutely. And so just to clarify for the listeners that you realize kind of, there's postpartum depression, anxiety from your son's birth.
Yes.
Right. So
yes.
19 months.
Yes.
Wow. Okay. Yeah. Yeah. That's big.
And it didn't click until that moment because I wasn't getting support or anything from a healthcare provider during the pandemic. I didn't see anybody.
Right. So yeah, absolutely.
It kind of flew right under the radar.
Right. And now this is an opportunity, so to speak, for it to really come out. And this is, a place where we can't really suppress it anymore, right? It's just all coming out because this is so huge.
Yes.
Absolutely. Okay.
And I didn't really touch on this before either. But I was nursing him up until this point.
Nicole.
And so when I was given the methotrexate the week prior, I had to actually stop completely. I didn't realize the last time I nursed him was the last time I'd be nursing him. So that added another heavy layer to it.
Wow, Nicole, I'm just thinking of the layers of grief around that.
I knew in my heart too that he was in good hands.
Yeah.
Right. He was being taken care of. He loves my mom. It was great. And I'm glad she was there. And I didn't have a choice. I didn't have a choice in going at this point. He said like he can't legally let me leave.
Right.
Knowing that it was life-threatening at this point.
Right. Okay.
So they called the ambulance and I hopped into a stretcher and hopped into an ambulance, my first ambulance ride.
Right.
I still remember the one paramedic tapped me on the shoulder and said, "We're going out with lights on and sirens on only because we have to." I think he was doing that as a comfort thing.
Yeah.
Like, don't worry.
Yeah, it's okay.
Not as scary as it needs to be, but
yeah. Yeah. Oh gosh.
So that was interesting.
Yeah.
My husband wasn't allowed in the ambulance, so he followed behind. He drove down. So we got sent to RVH in Barrie.
Okay.
So my husband drove behind me. So this is about 8:00 at night.
Yeah.
So we got down there about 9:30.
Yeah.
I got to the hospital there and they had no recollection of me coming in. So that was stressful again. Finally got all that sorted and stuff. I met with the surgeon. She was great. She was lovely. She was very supportive. She told me initially that she didn't know if I'd be able to get surgery right away. I might be staying in the hospital until something was available. But then she ended up pulling some strings and got me in. She said that the methotrexate was actually working in the sense that my numbers were going down. She said if I lived about 5 minutes from the hospital, she'd be okay with trying another dose. But because I lived far and what she considered remote, she said if I were to rupture, she was afraid that I wouldn't get to a place in time to save me. So that kind of hit me a little bit too.
Yes, I was going to ask you, how was that in the moment to hear that?
You know, it was weird. I remember when she told me that she had to do the surgery and there was almost a sense of relief.
Wow.
Like,
yeah,
I could breathe a little bit again. And surgery is terrifying. Don't get me wrong.
Yeah.
But I was living in such a constant state of panic that to know that surgery would happen and I wouldn't have that feeling.
Yes.
Sign me up.
Yeah. Yeah.
I was
absolutely.
done. I was so depleted. Sign me up.
Yeah. I can't cope with this anymore.
She said, I asked her if she could save my tube. And she said, just from what she could see initially, she said that it was too far advanced, that there would likely, even if they tried to, there would be too much damage.
Right.
And someone who experiences an ectopic pregnancy is already at a higher risk of experiencing another one.
Okay.
And so to leave that damage of a tube in there, it would just increase the chances. So I said, sure, let's go ahead with this.
And how was that also in the moment? Again, I fully recognize that you're about to go into surgery, but in the moment to have to make that decision, do you remember what you were feeling or thinking about that?
I think I was still stuck on just I don't want to say this is the easier way, but for me, it seemed like the best option
at the time.
Yeah.
Yeah.
And I didn't think through it a whole lot. I just told myself that, hey, you don't have to live in complete panic anymore.
Absolutely.
Right? It's just you go into healing and everything, but you don't have to have that extreme level of panic every day. So that kind of gave me comfort in a sense.
Okay. And so then when did you end up having the surgery?
That would have been that night at around 10:30. I was in there 10:30 at night on a Sunday. and they were, it was weird. It was eerie because we are in the pandemic. I'm in a big hospital, and once I got out of Emerge, it was almost ghost-like. I think I saw two people
Right.
in the whole time I was getting transferred up to the OR.
Right.
I just remember thinking that was a very weird feeling that no one was around. I got into the surgery room. They were very chatty. There was quite a few people in there. I remember that. Um, yeah, not much more about that. Like it just felt very, it was a very big room, I remember thinking. And you feeling very exposed and very vulnerable during any kind of surgery like that, right?
Absolutely.
Right?
Yeah.
So that was an interesting experience in itself. I was able to ask a few questions before they put me under. Not to any great detail, I don't think.
Right. And your husband at this point, was he still inside the hospital? Was he able to stay inside or he had to stay outside?
No, yeah, he was outside in the parking lot and he stayed out in his truck
Oh my
and just waited
gosh.
to hear back.
Wow. And can I
Yeah.
ask, like, has he, if it's okay, and if you don't want to share, that's okay. Um, did he say like how that felt for him being out in the parking lot?
He's an interesting guy. So
Okay.
he's he's like a ignorance is bliss kind of person.
Yep, yep.
He doesn't like to look up negative information unless he absolutely has to.
Right. Yep.
So he was getting a lot of information from me because I'm the opposite. I
Mhm.
need to research every little aspect, right? I need to try and understand everything. So he's getting information from me, but he's not looking it up because he doesn't want to be afraid of it. He doesn't want to
See the worst case
worry.
scenarios and
Yeah.
yeah.
Yeah, he doesn't want to be like that. So up until this point, he hasn't really done any of the research behind it
Right.
until he was in the truck, he told me. That's when he started looking stuff
Oh
up.
boy.
So, and he found support groups with men that have been supporting women through this and
Right.
telling their stories about their biggest fear was of losing their wife during surgery.
Yeah.
And so now all of a sudden the panic starts to set in with him
Oh gosh. Right.
while he's by himself
Right.
in a parking lot at 10:30 at night in a city
Right.
where no one else is around.
Oh my gosh. And I just want to acknowledge that we've heard so many stories over the pandemic of, partners, dads, husbands, wives, anyone like sitting out in the parking lot, waiting for their partner to go through a surgery or even a birth, right? At some points throughout the pandemic, when people in some places in the world, people weren't allowed in the birthing suite or things like that. And we've seen images, right, of people in the parking lots and looking into the windows and stuff. And I just want to acknowledge, the kind of collective hurt and trauma too that can come from those types of situations. My goodness. Wow. Wow.
Mhm.
So tell us, you know, the rest of your story.
So I had the surgery around 10:30. I think I was back in recovery around 12:30
Mm.
in the morning, I guess now.
Yeah.
I was in a massive room.
Mm.
I want to say there was like 30 beds. It seemed like a very big room. And it was just me and two nurses on at night. I was still very groggy from the anesthetic. And I'd wake up and then fall back asleep and wake up, fall back. They tried to talk to me to get me awake. And I was struggling with it. They said that they needed to get me up, needed to swing my legs over and start walking, which I know from having a C-section 19 months exactly to the day that you need to get up and start moving around.
Yeah.
But I just felt like I wasn't there yet. I was still very spinning. I could barely keep my eyes open, but it seemed very pushy.
Oh, wow.
So I tried.
Mm.
I tried to do that. They had me walking a couple steps and then go back.
Mm-hmm.
And then they said, okay, well, we need to get you to go to the bathroom before you leave, which also I know is something you need to do especially after abdominal surgery.
Yep.
And I said, well, I don't feel like I can.
Yeah.
They basically just pushed me there. They got me to the bathroom, and I remember they wheeled me over in their wheelchair and said, okay, here you go. And I remember standing up and then collapsing to the floor because I couldn't walk. And then I had this sudden urge to throw up. So I was trying to stomach that so that I didn't throw up everywhere. So clearly did not make it to the toilet.
Yeah, of course.
And then kind of crawled my way back out to the wheelchair. And I remember asking them, like, I can't stand up without feeling like I'm going to vomit. Can you give me some nausea meds? And they're like, no. There's just like a hard no. It's like,
Oh,
okay. And they wheeled me back and they said, okay, well, you need to start getting your stuff ready and we can get you to go home. It's like, I don't feel like I'm ready to go. I remember just thinking it was the weirdest feeling. I did ask them, I said, you know, do you guys get to go home after this? Because I was in my head, I was like, you're trying to really push me out.
Yeah.
And they're like, oh yeah, after you're gone, we're going home. I could feel that.
Oh,
I could definitely feel that.
Right.
And I get that, you know, everyone's busy right now. The pandemic has not done anyone favors.
Mm-hmm.
I know in the hospitals too. I know that they're overworked and
Mm-hmm.
they're extremely busy and they're tired. I know, and I get that in my heart. I know, and I get that.
Mm-hmm.
But I just went through a loss of a pregnancy, a loss of a piece of me, and almost a loss of my life. And they didn't have the decency to just even let me rest for a little longer, talk to me about it. I asked about the surgery. They couldn't give me any details, or they just said, oh yeah, they got your right fallopian tube. But I had questions, but they were more focused on just getting me out the door. They sent me home with a little sheet, like half of an 8.5 by 11 sheet with aftercare on it, because she said, you know, there's probably a lot of information that you're not going to remember from this. So we're going to give you this little sheet to say like your wound care, basically.
And was that specific to ectopic pregnancy, or was it just like wound care?
No, it was specific to this surgery.
Okay.
But it was very basic.
Right.
Like, it would have been really nice to be like, okay, so you're not going to retain a lot of this information, so I'm going to give you the aftercare stuff, but also, hey, you just went through an extremely traumatic experience. How about we also send some information of people you can contact to talk to? Maybe there's a support group that you could talk to, peers. Maybe just some basic information on what just happened to your body and to you, to your mental well-being, so that you don't have to go home when you're exhausted and overwhelmed with all these feelings and hop on Dr. Google again to tell you all these things that may or may not be right and can just make the whole situation that much more overwhelming.
Right. That would have been more helpful.
Yes.
Yeah.
And even after maybe 2 or 3 weeks after recovery, I still had all these questions. No surprise. They said I could call back to the office to try and get some more answers, and I did, and I never heard back from them. So also that was a no. So.
Wow, Nicole. And did the surgeon, like before you were discharged, did the surgeon come to see you after the surgery?
No. It was just those 2 nurses in that recovery room.
Wow. And so when did you end up actually being discharged?
So I was discharged at 2 a.m.
Wow.
And they wheeled me out to the doors so I could meet my husband. And then I was back in my own bed for 4 a.m.
And how were you feeling at that point? Like when you were actually discharged, like had the nausea stopped, or like, how were you feeling?
Weirdly, so still a little nauseous, but just a stupid little story that my husband tends to eat when he's, emotional or cranky or anything. So he got a pack of Timbits, and he saved me one, and it was the best tasting donut.
Oh, right.
So,
oh,
so that was nice.
Yeah.
But I remember still being very, I felt like I didn't have control of myself. Like I was still very groggy.
Right.
So just like laying in the truck. I had no sense of time of even where we were, of how we were getting home. And then just of my husband saying, okay, we're home now. And just trying to walk in the house quietly to not wake up my son. And it was just, and that was it. That was it. It was over.
And what were your pain levels at that point, where you still had enough like pain medication that you, because I'm just thinking, how was walking for you?
It was fine. I think I was decently medicated. I don't think I actually started feeling really sore until about 48 hours after.
Okay. Right. And then did they send you home with pain medication?
Yeah.
Okay. Okay. So what was recovery like after getting home from the hospital? What was that like for you?
You know, it was a lot of resting, which I felt like I wasn't allowed to do for the 19 months prior. It
Right.
actually forced me
The
to
rest.
lay down, rest.
Right.
I mean, whatever rest actually is, I couldn't sleep. And that was more of the thoughts and the images and everything that were going through my head that didn't really allow me to sleep. The nightmares were vivid and very intense, to the point where I'd be so exhausted, so I'd fall asleep, and then I'd fall into these absolute nightmares, and then I'd wake up and then I couldn't go back to sleep. Anytime I closed my eyes, then I would see it. So that was a struggle.
That trauma, that post-trauma, right? Like your brain processing, trying to process everything that happened to you. Yeah, absolutely.
Yeah.
Yeah.
I was so thankful that my mom came up. So she stayed through the week. They'd go home, and my husband would go on care duty, we'll say, for the weekend.
Yeah.
And then she'd come back up for the week. My mom and dad live 3.5 hours away.
Wow.
So it's not like a little
quick, 5-minute
drive.
drive. Yes. Oh, wow. Wow.
So very, very thankful for that.
Right. And while we're on the topic of like support, who else was in your support system? Did you have anyone else in there? You had mentioned some friends earlier that came over. What was that like for you?
Yeah. My husband was very supportive throughout it.
Yeah.
And then, yes, our two closest friends,
Yeah.
they were very much involved as much as they could, right?
Yeah.
I actually messaged them from the ambulance saying, hey, this is what's going on.
Wow.
Yeah. So I'm very thankful for them as well.
Yeah.
Aside from that, I mean, I honestly, I wasn't very quiet about this, and which is interesting, I think, for a lot of people, because a lot of people, I tend to not talk about this stuff, right? It's still, oh, it's unfortunate because people feel like they can't talk about it, right? And I don't know what was in me at the time, but I was like, all right, I need to shout this from the rooftop. And not to try and get sympathy from people, but I put my story out there and was more or less like, hey, you know what? This actually happens to someone that you know. There's chances are someone else has gone through it and doesn't feel comfortable about talking, which I 100% get. Yep. 100%. But I just wanted to put something out there so that at least other people know that they're not alone.
Absolutely. Yeah.
Yeah.
Which is, I think, the incredible part and the important part of sharing our stories, right? So that people, when these things happen to any of us, because they do happen, we can find some glimmer of comfort and hope, right? Wow, someone else went through this and they recovered, right? Like that's also, I think, nice to see too, of okay, there is some hope there. What, you know, what was the physical recovery like for you? How was that?
It wasn't too bad.
Okay.
Really.
Good.
It was really the first maybe 4 or 5 days where it was hard to get up and move. And then after that, it was because you have to get up and you have to keep moving, right, for the healing process.
Yeah.
And I was maybe a little bit sore for maybe say 2 weeks, and then I was back on hanging out with my kid, and things were quote unquote normal.
Right.
There was, so you can get a keyhole surgery, laparoscopic surgery. They go in. For me, there was 3 just tiny little spots where they go in.
Mm-hmm.
So it was just kind of monitoring those sites. Thankfully, I didn't have the full abdomen open, which would be obviously a lot more healing to that.
Yeah.
But yeah, honestly, the physical recovery was nothing compared to the mental recovery that I'm still working on.
Absolutely.
That's the lasting one, right?
Yeah. And so do you mind sharing with us then what was that mental recovery? What has that looked like for you?
Trauma changes you,
Mm-hmm.
right? It changes everything. The person that you knew before is now someone completely different. So things that wouldn't have, I wouldn't even have noticed before, I'm suddenly very aware, to the point of an ambulance drove by with its lights and sirens on, and I had to pull over because I couldn't get out of that spot. Stuff like that. Hearing other people's stories about pregnancy.
Mm-hmm.
Usually I'm super pumped, excited, which I still am.
Yeah.
But it was a different layer of like, okay, so I should be having a baby right now and I don't get to. And that's really hard, right? That's not something I've really experienced before either. I've always been, just really excited for someone to start that journey. And it was weird because it seemed like a lot of people I know were actually due around the same time that I was due. And that was really hard, really hard.
Yes. And so is the due date something that you decided to hold on to kind of commemorate in any way, or did you want to let it pass? Like, what was that like for you? Because I know that's different for everybody.
It's really hard because the due date is Pregnancy and Infant Loss Awareness Day.
It's the same day. Oh, Nicole.
I laugh, but it's just that's what happened. It was so it's hard to not think about it.
Of course.
Obviously, that day and all it means and everything like that. So it was a hard day, but it was more or less a day of reflection.
Right.
I didn't really do anything to commemorate or anything like that. I just reflected on what had all happened, what got me to this point. As sad and traumatizing as the whole event was, I survived and I'm still here. So I still have to just remind myself that, I'm still
safe,
ready to take on the day. Yeah. Yeah.
And so you had mentioned that previous to the ectopic pregnancy, after your son not having supports in terms of mental health supports or even kind of really interactions with healthcare providers because of the pandemic and, I guess not really feeling the need to touch base with anyone. After a 6-week appointment, no one really bothers to follow up with us anyways, right? So, so after this experience, did you seek support, whether that was peer support or a therapist? Did anyone like that become part of your support system afterwards?
I remember trying to look for support after, as much as I didn't really want to interact with the whole group atmosphere at the time. I tried to look for support groups or anything like that. I connected a couple different agencies and I just never heard back from them, or I did, but they said they'd get back to me and never did. So I kind of was left in limbo there.
Wow.
I did eventually call a therapist who was trained in perinatal mental health. She was lovely, absolutely lovely.
Good.
But the thing is I wasn't directed towards anything related to this kind of loss, this whole event. I tried to reach out to my midwives,
Okay.
thinking that midwives would be loaded with
Yeah.
information and support for something like this.
Yeah.
And I love my midwife. She was amazing. And she was very honest and said, you know what, there's a lot of support and information for miscarriages,
Yeah.
but in this kind of loss, there really isn't. And she was then starting to look for support through Barrie and Toronto and everything like that, which pandemic wise, everything's online anyway, so it would have been fine.
Right.
But it's not really something that I was looking for. I wanted support up here.
Yeah.
Right.
Right.
And, you know, miscarriages are absolutely horrible and very painful to go through. But then an ectopic pregnancy on top of it, it's like it was a whole other level. Because you're losing a pregnancy, but you're almost losing yourself and a part of you potentially, right? Which I don't think a lot of people know or understand because it doesn't get talked about enough. So ectopic pregnancies are not talked about enough,
Right.
but they are actually a lot more common than people think.
Right.
And they are a leading cause of maternal death in the first trimester.
Wow. Wow. And so that's important for us, A, to know, and then B, to talk about, to get that information out there. Again, a big reason why we're doing this episode is to talk about this experience and the signs and symptoms, right? So people can know what to look for and get help, get to the hospital right away so that, you know, the outcomes are not as bad as they can be.
Right.
Right.
Because it can go from, you know, you're fine to you're not fine.
Yeah.
In very, very quickly once you start bleeding internally. So some signs I feel like we should talk about as well because they're not really talked about.
Yes, go for it.
Because a lot of things in early pregnancy can be the same across the board, right? So I think that's where a lot of people, they don't go and get looked at because they think, well, this is just part of pregnancy, which is what I did. So if you are bleeding in that first trimester or anytime throughout, you should go get looked at, even though it can happen. It can happen in pregnancy, but you should get looked at. If you're getting any kind of pains, which can also happen in a healthy pregnancy, but go get looked at. Rule out that you could have an ectopic pregnancy.
Yeah.
There's an interesting one that I don't know if a lot of people know about too, is shoulder tip pain. I don't know if you've heard about it.
I haven't. And you mentioned when you were discharged from the hospital the first time, they said, if you have shoulder pain, come back. So tell us more about that.
Well, it's just because it's such a weird one. People don't actually think about having shoulder pain.
Right.
Right. So when your abdomen fills up with blood, if you're internally bleeding, it actually hits a nerve in your diaphragm,
right,
which actually refers pain to your shoulder tip for whatever reason.
Okay.
I don't have a medical background, so I can't go into more details.
That's
but
okay.
that's a big one. That's a big one for ectopic.
Okay.
Is that if you're internally bleeding. Same with if you have bowel pain, because it's putting pressures down there.
Right.
And so if you have any of those kinds of pains going on, you have to go to the hospital immediately.
Okay.
Right.
Yeah, absolutely.
And like vomiting, diarrhea, anything that makes it seem like you're having like a heavy flu or anything like that.
Right.
Just go get looked at.
Okay.
I am the worst person to go to the hospital when I'm feeling bad.
Right.
But I'm going to be a massive, huge advocate.
Yes.
For people who are experiencing any of these kinds of symptoms to just go get looked at.
Go get checked out. Yeah, absolutely.
Peace of mind.
Yeah.
If they say, hey, everything's fine, great.
Yeah. Absolutely. Do you know the kind of timeline of how long it can potentially take for an ectopic pregnancy to rupture if it's not taken care of?
Yes. Okay. So ectopic pregnancies typically rupture
Mhm.
on average between 6 to 10 weeks,
Okay.
usually 6 to 8 weeks.
Okay.
If we're going to kind of like narrow it down a bit,
Mhm.
that's why it's so important to get ultrasounds as early as possible.
Right.
When they said to me, if I were to get pregnant again, as soon as I got a positive pregnancy test, I need to go and get an ultrasound.
Okay.
So when I talked to someone about this after the fact, I asked why we don't do early ultrasounds. And they said because it will put fear in people that they don't have a viable pregnancy because you can't see a heartbeat that early.
Mm.
So to me, I was just kind of like, okay, so why don't you just explain why you're doing it this early? You
Right.
explain to the person saying, there is no heartbeat right now. We are just checking to make sure that it's in the uterus.
Right.
That's because that's essentially what it is, right?
Right. We're
So,
You could pitch it as we are just performing this ultrasound to check for ectopic pregnancy.
yeah.
That's it.
And I don't think that would be so hard for people to understand going into it. Like
Absolutely.
this is a very serious condition, so
Mhm.
let's try this out. If everything's looking like it's in the right spot,
Mhm.
then you can book and do your dating scan, or I guess that could be your dating scan at that point. But then we can do a further one and make sure everything is progressing as it should. And check the heartbeat, check everything that you need to at that point.
Absolutely.
It's so vital, and it's frustrating that they're telling me now that, oh, so you've had an ectopic already, so as soon as you get that pregnancy test, then you do this early ultrasound. Well, why doesn't everybody get that?
Right.
It shouldn't just be because I experienced it.
Why
It's
isn't
a
it
lot more people think.
right? Why isn't it the standard of care?
Right.
Right. Okay. And so does your risk of ectopic pregnancy increase if you've already had one?
Yes,
Okay.
slightly.
Slightly. Okay.
I think it's something like 15%
Okay.
or something.
Okay.
So
Right.
a little bit, but definitely more than someone who hasn't had one.
Right.
Yeah.
Okay. And so how, I know that healing, that emotional and mental healing is obviously a big piece, and we would need another 10 hours to, just talk about that. And so I want to acknowledge that, I fully understand that there's so much more that we could talk about in terms of that experience, that part of your experience. Can you tell me, though, kind of where you're at today in terms of your healing emotionally?
I've had a few months now. It's been almost, well, it's going to be a year soon coming up.
Mm.
So I've had a bit more time to process things. I feel like it's still going to take a long time. I mean, trauma doesn't disappear either. No matter how hard you work on it, it's forever there with you, right? I'm hoping that I can just help other people that get through it. And feel like by helping other people, it will also help me understand what happened. Um, in the last couple weeks, I've reached out to the two main hospitals that I had went through the whole experience with, my main hospital and RVH in Barrie, and they sounded very supportive of wanting to talk with me and discuss how we could make maybe some positive changes in our community, which I am so excited about. And it's I'm hopeful. I'm staying hopeful. I know that it takes time. I know that there's not a lot of support anywhere for this kind of thing, and I'm just hoping that I can be part of the change that we need. And then hopefully that helps me too, right? That'll help me heal, that'll help me process this and know that I'm also not alone, because I still don't know a lot of people that have gone through it myself. So I'm hoping that, it can allow for more conversation.
Yes, absolutely. And can I just say, Nicole, that that's amazing that you reached out to those hospitals after having such traumatic experiences there, because that is really, really hard to do after we've experienced a loss, after we've experienced something traumatic, surgery, all of those things, that is not easy to then kind of, even though physically not necessarily returning to the site, but engaging with them and trying to talk about your experience and then also try to help make change from that. That's amazing. And so thank
Hopefully.
you. Yes, absolutely. But thank you so much for doing that, because it's really hard work to do, and also I think so helpful, right? Looking back, I know that it can be hard to you know, first of all, look back, but also think about, okay, what could have been helpful for me in that moment? Because, we can't really go back and change it. But if we think about what can we do going forward, what would you have needed then to help you in this experience in any way?
There's a couple things.
Okay.
The first one that comes to mind would have just been some form of information.
Right.
So to kind of paint a picture here, for both hospitals, my personal hospital and RVH, I was there for a minimum of 5 hours. So in that time, even if someone had just some kind of information about perinatal loss, what to go through, specifically if there is loss about ectopic as well, just something that, in that moment, 100% trauma blocks out the information that is being spoken to you.
Yep.
But just having something to go home with, so that when I've actually kind of, said, all right, this is what's happening, I need to find out what's going on, then I can have something to look at to say, okay, if you need someone to call, there's this person and this person. If you want a peer support, there's this person or this agency to call. Do you just want to know what happened to your body, the whole process of it?
Yes.
What usually happens? Here's just the breakdown of, what is an ectopic pregnancy and what are the different treatments, because there's also expectant management. So sometimes they find out the ectopic and they just kind of wait it out, which is terrifying in itself. But if you find it early enough, potentially you do that, right? Just the different options. I wasn't given any of that. I didn't, like, he explained the situation, but to have something so that when my head was a little bit clearer, I could actually look at what was going on and have people I could contact.
Yes. And would it be helpful too, on that kind of brochure, so to speak, to have like the signs and symptoms when to return to hospital?
Yes, absolutely.
Yeah.
Yeah,
Okay.
100%.
Okay.
Yeah, if it's going down to like a specific for ectopic pregnancy loss,
Right.
then 1,000%.
Yeah.
Because a lot of those symptoms, like I'd mentioned,
Yes.
they overlap with a healthy pregnancy.
Right.
But there is some degree of differences. Like if you're laying on the floor in pain that you can't move,
Yeah. That's
go to the hospital.
not normal.
Right.
Yeah. Okay.
Just another thing too that I wanted to add was just I wish that we could implement into hospitals more of a specific perinatal loss language,
Hey.
for lack of a better way of saying that.
Yes.
But um, more like to be sensitive
Yes.
of this kind of loss. The doctor that I had at the end there, he didn't know how to talk to me. He
Yeah.
didn't know how to, which is, it's fine because you're not going to be educated in everything, and I get that.
Mhm.
But knowing at least to some extent of everything that I'm going through, like I felt like I was panicking at 100. I just wanted him to come up a little bit with me
Yes.
and not just sit in the lounge level where he's just like, hey, what's going on? I
Right.
need you to come up a little bit and understand the amount of trauma and everything that I'm experiencing right now. And when I experienced my miscarriage, the term that they used in the emergency room was missed abortion. I would love to see that language be updated, because when someone comes in and says they have a missed abortion, you suddenly have thoughts of, okay, so did I do this? Is this my fault?
Right.
So I would really love that as well. And I don't know what that would look like, or,
Sure.
you know,
Right.
I
Absolutely.
don't know a lot about how hospitals are run or anything, but
Yes.
that,
Yeah. And what is the language that for you fits, first of all, for when you had your first miscarriage, what word or language would you use that works for you? Is it miscarriage, pregnancy loss?
I would have accepted miscarriage or pregnancy loss. Both of them are more
Yeah.
acceptable. Both of them are more, like miscarriage is so common.
Yeah.
Right.
Yep.
And miscarriage also comes with that whole feeling of it's not my fault. This is something that is out of your control.
Yes.
Right. So that kind of gives you a sense of, all right, this sucks.
Yes.
But this wasn't in my control. When they said missed abortion, that word still holds so much stigma of, I chose to do this.
Right.
This is my fault.
Right.
Right. Even though I knew it wasn't, but
absolutely. But
in that moment.
Yes.
Right.
Yeah. You're in an already vulnerable state. Right. And I talk about this all the time, that even in any of those types of vulnerable states in that perinatal period, we are so, I think, in tune to what language is being used, even facial expressions, how people are interacting with us. And so I think it is really important for healthcare providers to be able to recognize that. And, even just it, of course, we know that a surgeon in an ER is not going to be your therapist, but they can understand, even from a logical medical perspective, that this is a pregnancy loss, right? Any type of loss can carry a great degree of difficulty, whatever that loss is. And so just simply understanding those basics, I think, would have potentially been helpful, so that he wasn't asking you, why are you crying? Right? Because if we lose anyone or any type of situation, there can be sadness there.
Yeah.
So, yeah, absolutely. What do you want to see change? And I know you talked a lot about it and you gave some incredible ideas. What do you want to see change in terms of the supports for people who are experiencing ectopic pregnancies, going through ectopic pregnancies, um, any type of pregnancy loss, really? But what are those things that you want to see maybe happen in this space?
Honestly, I just wish that there was just availability of support. Like there's specific training that I took, as well as you took.
Yep.
So I took it last summer to be trained in perinatal mood and anxiety disorders, as well as perinatal loss. And so I'm not expecting everyone to get trained in that, obviously, but it would be nice to have more access to people that are specifically trained in that.
Absolutely.
And I mean, the pandemic has allowed for us to do virtual meetings and stuff, which is fantastic. But it would still be nice to have more connections within each community. So if that is a therapist one-to-one, if that is a peer support group,
Yes,
that just has the actual knowledge specifically to that, because it is a loss, but it's not just like any loss.
right. It definitely
And
has its own nuances, so to speak.
Right. And that's the one thing that the midwives did say, that they could connect me with a grief counselor or a grief support group. I can't remember exactly at the time, but she said it's all grief. Like it's the whole umbrella, which at the time is not what I was also looking for. I was trying to process what just happened.
Yeah.
I know that to some extent grief has similar
Stages.
like theories and stuff behind it, but this one I wanted specific, like what just happened, why did this happen to me, and trying to unpack all that.
Right.
And it didn't seem like there was anything available specifically for that.
Wow. And so even online, you weren't able to find something specific for ectopic pregnancies in terms of support?
Well, I feel like I could have went through Postpartum Support International, right? They
Right.
have the support groups and stuff like that. But I really wanted to find something local.
Local.
As weird
Yeah.
as everything's virtual,
Yes,
I still wanted something local, right?
that's fair.
I wanted to know that my neighbor was helping me.
Yes,
kind of
yes.
thing.
And that is also the beauty of peer support, right? Where we connect with people who have experienced the same thing. And I see that in this work and in this community where that is so helpful. Like, wow, like you said, I'm not alone. This other
Mhm,
person knows the depths of despair and trauma and hardship and also recovery, right? Like what that can
mhm,
look like and how that can feel, and that it is possible to come out of this. And so I think that, that is a gift to be able to have those types of supports. And there's nothing wrong with wanting that local support, right? So
mhm.
absolutely. And, hopefully one day, not everything is virtual. I mean, it has been helpful in connecting people sometimes in rural communities, and in giving access to people in cities that they don't have the same access like in the bigger cities. And, hopefully one day we can have those in-person, more so those in-person meetings again, and having that sharing, because it is so helpful.
Mhm.
So more specific peer support, and even, like you said, those therapists trained in perinatal mental health, and also knowing and understanding the process of ectopic pregnancies.
Yeah, for
Yeah.
sure.
Yeah. So that the person's, for example, especially in a peer support group, right? If it's just specific to ectopic pregnancies, then it's really going to be those people in the group that really understand what you went through,
Mhm.
which would be helpful.
Yeah, for
Right.
sure.
Okay. And
Yeah.
and just so the audience knows, if you are a therapist and you're listening to this, or a therapist or someone who works in, mental health field, you can get trainings all through Canada at Canadian Perinatal Mental Health Trainings, and I will put a link in the show notes for that, because they're an amazing organization and they provide amazing trainings to be able to support people who are experiencing perinatal mental health and mood and anxiety disorders. So, Nicole, I just want to thank you so much for sharing your story and being vulnerable to do that, because that was so heavy and difficult, to say the least. And I think it's going to be so helpful for people to listen to this episode to understand the signs and symptoms. And in the show notes, I will post links to information about ectopic pregnancy so that we can get some more information out there. And, also we can work towards some advocacy for supporting people and who've experienced ectopic pregnancies, and get some information out there. How does that
That's
sound?
that sounds amazing. I want to say thank you for allowing me to come on here and talking
Of
about
course.
everything, and hopefully it reaches, even if it just reaches one person
Yeah,
that feels like they could not talk about their experience, or they felt like they were completely alone in it, you
absolutely.
know, you're not alone.
No, absolutely not. Thank you so much. I truly appreciate Nicole for sharing her story with an ectopic pregnancy and how difficult that experience was for her. I don't think we talk about ectopic pregnancy enough, and I hope that this episode can help to open up the discussion around it. If you experienced an ectopic pregnancy or any type of pregnancy loss, please know that you are not alone and we are here to support you. You can reach out to us at info@perinatalwellbeing.ca or reach out to Nicole at linkslakecounseling.ca. Thank you so much for listening to this episode. Please share this podcast with any of your friends or family members who may benefit from it. If you feel you are experiencing any of the symptoms or issues that we discussed today, please reach out to any one of your supports. You can also go to perinatalwellbeing.ca for more information, blog posts, and podcast episodes. Check out our new episode every Wednesday.